Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to get into my disclaimer and reminder that there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AANP exam. Now, if you see any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states the nurse practitioner and NP student are discussing a painless nodule on the patient's eyelid. What is the most likely diagnosis? Is it A, chalazion, B, hordelum, C, sty, or D, a pimple? Take a moment and tell me what you got in the comments, you guys. All right, you guys, I always recommend reading the stem of the question first to ensure that you're answering what is being asked of you. So here it says, what is the most likely diagnosis? And I tell you, if they're asking for a diagnosis, you need to run it back and look at the assessment findings. So here, this patient has a painless nodule on their eyelid. Now, there's things that I tell you, if they present similarly, we need to know ways to differentiate between the two. So we can have many nodules on the eyelid, but the two most common are your chalazion and your hordelum, right? So then you need to know one versus the other. Chalazion is painless, whereas a hordelum is painful. Okay, so that is a key description that will help you to differentiate between one versus the other. Also remember, a hordelum and a sty are the same thing. Okay, so know the various terminology so you're not missing things just because they used a different term. Okay, so the best answer here is A, chalazion. Question number two, the nurse practitioner and NP student are discussing dermatologic descriptions. The NP student inquires about what term describes a blemish. What is the appropriate response? Is it A, papule, B, pustule, C, macule, or D, bulla? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here states, what is the appropriate response? So what are we responding to? The nurse practitioner and NP student are discussing derm descriptions, right? And the NP student is inquiring about the description for a blemish. So make sure you know your derm descriptions terms because if you're getting these, one, either they're going to really, I tell you, if we're talking about derm, pay attention to the location. If there's classic locations where they typically present, if you don't get an image on there, they're going to have to name that location, and that's going to help you to determine which derm disorder this is. But also, they can use derm terms, right? Dermatologic terms to help you identify what is truly here. So, a blemish is best described as C, a macule. And if you look at any of my derm videos, I do my Britney's Brilliance on macule, and I say I think about MAC makeup, MAC makeup, because you use your MAC makeup to cover your blemishes. Okay, so the best answer here is C, macule. And then question number three for today. The nurse practitioner and NP student are discussing calcium channel blockers for hypertension management. All of the following are calcium channel blockers except. Is it A, Norvasc, B, lisinopril, C, amlodipine, or D, nifedipine? Take a moment and tell me what you got. All right, so instead of the question here states all of the following are calcium channel blockers except, so when this except is here, we're looking for the incorrect one, right? So knowing your endings, knowing your drug classes, I'm big on that. So here, knowing that a calcium channel blockers ends in pine, Pine. So you can already select amlodipine C and nifedipine D to be correct answers, right? And if you're stuck and don't know alternative generic and brand names, you still, if you know your endings, you should be able to eliminate lisinopril because the ending pril are ACE inhibitors, right? So B is the answer because that's an ACE inhibitor. It's not a calcium channel blocker. Norvasc and amlodipine are the same thing, okay? So I just did it in this fashion so that you can see. You probably are more familiar with those drug names, but in the event that is something that you struggle with, look for the endings that you can quickly identify that is correct, and then utilize the endings that you may know, like Pril, and eliminate what you know is obviously incorrect, right? To narrow it down, even if you get stuck, because there's so many medications. So make sure you know how to approach it. But my biggest thing with farm, when you review it by system and look at the drug classes. Learn the class and their endings, so it's easier to group them together. In the event that you're in a situation like this, you can do elimination or think through things that present similarly, okay? All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. And if you need any of the resources that I offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email at the nursing studio, the number one at gmail.com. The things that I offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you're looking for a self-paced review where you can study on the go on your own, watching videos for each system, is designed for family as well as adult Gero. That is also linked in the bio of this channel. Our 5-week intensive group review starts in September. The link will be in the description so you can enroll for that. And then lastly are our one-on-one sessions. If you're looking to enroll in any of the one-on-one sessions, I always say reach out first, as these are customized. So let's determine what is best geared for you. Things that we do offer are one-on-one sessions for your weaknesses. So you can book a session for 1 to 2 weaknesses per session. You can book an exam readiness assessment. Or lastly, you can book the custom package where you're provided a pre-test initially, and based off of where it is determined your weaknesses and strengths are, we'll design a structured study plan for you. So say that you want to allot 2 weeks to studying or 4 weeks to studying. We'll design your study plan based on your weaknesses and strengths for that time duration, and then work alongside with you during that time to take you to a successful exam attempt, okay? So if you need any of those resources, feel free to reach out to the Nursing Studio, but y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.